Okay, Foster here. We're going to talk about neurogenic shock. I think we all talk about trauma and hypovolemic shock, and we talk about sepsis and shock, but just real quick on neurogenic shock. Um, Something else to think about in trauma. You know, usually trauma is hypovolemic. We need volume, blood fluids, blood products. Shock, by definition, is inadequate perfusion of organs, so they do not function well. Neurogenic shock is a type of distributive shock. What that means, it's a distribution problem. You don't have any sympathetic tone or decreased sympathetic tone, so all your blood is pooled in your periphery. And this is seen in sepsis, sometimes it's seen in anaphylaxis. Anaphylaxis, you see it pooling all everywhere else due to mainly histamine release and other things. So hypervolemic, remember, everything is trauma. You need fluids, blood products. Shock, by definition, is basically inadequate perfusion of organs. They don't really function well. And neurogenic shock is a type of distributive type shock, a little bit different than hypovolemic shock. Distributive type shock or neurogenic shock, you got enough fluid in the system, but all fluid is pulling in the periphery. Because in the periphery you're having low blood pressure, it's usually pools in the peripheral because you've lost that peripheral tone or that sympathetic tone, which causes vasoconstriction in your periphery and pushes the blood back to your core. It's classically seen in cervical spine injury where you lost that sympathetic tone. The sympathetic system goes down, goes out to the periphery and causes vasoconstriction usually. So you have enough blood volume, it's just pooled in the peripheral system. We've got to get that blood volume back to the core. It's usually a high spinal cord injury in the C-spine or low brain injury. Because there is an injury, you can't get the sympathetic tone down out to your peripheral. There's no more sympathetic tone to keep the blood vessels from constricting. Blood vessels in the periphery tend to open up and become dilated, and all the blood appears to go out to your arms and legs instead of back to the core. So you can have a low heart rate, you can have a low blood pressure, because there's basically no sympathetic tone to increase that. So usually in hypovolemic shock, you just don't have enough volume, and usually they're more tachycardic. So sometimes in neurogenic shock, you get a low blood pressure and low heart rate. This is, of course, you work up neurogenic shock once you've found it's not hemorrhagic. Most trauma think hemorrhagic. This is after your FAST scan's negative, your CT scans are negative. There's not a lot of injury. There's no real injury that's causing hypotension, bleeding in the belly, bleeding in the chest. Also, the patient might be paralyzed or numbness or tingling if they're talking to you. You can get priapism too, remember, from increased parasympathetic tone and decreased sympathetic tone. Remember, trauma, like we talked about, is mainly hemorrhagic shock. Neurogenic shock, they may seem warm due to the pooling in the peripheral system. Usually hemorrhagic shock, they're kind of mottled and cold in the peripheral system. You'll see it in the legs. They're cooler and pale because the body's clamped down or vasoconstricted in the extremities and arms, trying to get that blood back to the core. One major clue to neurogenic shock is warm feet, warm hands, they say. And once again, this is due to loss of sympathetic tone. Obviously, trauma, we rule out hemorrhagic shock. We don't forget about neurogenic shock. They both can be going on. Consider IV pressures quick, in addition to just IV fluids, mainly for hypovolemic shock, it's fluids, blood. Where do these occur? They usually occur in spinal cord injuries and maybe upper thoracic. But once you get down to lower thoracic and lower lumbar, there's enough sympathetic tone to the rest of the body. Remember, brain injuries, spinal cord injuries don't do well with low blood pressure. And I think the main thing is this: don't be afraid to think of this isolated head injury, isolated spinal injury, to start pressors sooner than later. It seems like in trauma we're always starting fluids, blood. So consider pressors early and quickly in neurogenic shock.